1. What is the priority nursing action for a patient experiencing chest pain unrelieved by rest or nitroglycerin? Answer: activate the emergency response system and prepare to administer oxygen. Rationale: unrelieved chest pain suggests acute MI, requiring immediate intervention. Activating the emergency system ensures rapid response, and oxygen improves myocardial perfusion, per AHA/ACC guidelines. 2. What should the nurse monitor in a patient receiving nitroglycerin for acute MI? Answer: monitor blood pressure and headache. Rationale: nitroglycerin causes vasodilation, risking hypotension and headaches. Monitoring prevents complications, per AHA antianginal therapy guidelines. 3. What is the nurse's first action for a patient with suspected MI showing ST elevation on ECG? Answer: notify the provider and prepare for percutaneous coronary intervention, PCI. Rationale: ST elevation indicates STEMI, requiring urgent PCI to restore coronary blood flow, per AHA/ACC STEMI guidelines. 4. What should the nurse teach a patient about managing chest pain after an MI? Answer: take nitroglycerin as prescribed and call 911 if pain persists. Rationale: nitroglycerin relieves angina, and persistent pain may indicate reinfarction, requiring emergency care, per AHA patient education guidelines. 5. What is the priority nursing action for a patient with MI developing ventricular tachycardia? Answer: prepare for defibrillation and notify the provider. Rationale: ventricular tachycardia is life-threatening, requiring immediate defibrillation to restore rhythm, per AHA/ACLS guidelines. 6. What should the nurse assess in a patient with suspected acute MI? Answer: assess for chest pain, diaphoresis, and shortness of breath. Rationale: these are hallmark MI symptoms due to myocardial ischemia, guiding diagnosis and intervention, per AHA/ACC guidelines. 7. What is the nurse's first action for a patient with MI and a troponin level of 0.5 nanograms per milliliter? Answer: notify the provider and continue telemetry monitoring. Rationale: elevated troponin confirms myocardial necrosis. Notification and monitoring detect complications, per AHA biomarker guidelines. 8. What should the nurse do for a patient with MI experiencing nausea and vomiting? Answer: administer prescribed antiemetics and assess for hypovolemia. Rationale: nausea in MI may result from vagal stimulation or pain. Antiemetics and fluid assessment prevent dehydration, per AHA supportive care guidelines. 9. What is the priority nursing action for a patient with MI developing cardiogenic shock? Answer: administer prescribed inotropes and notify the provider. Rationale: cardiogenic shock indicates pump failure, requiring inotropes to improve contractility, per AHA/ACC shock guidelines. 10. What should the nurse include in discharge teaching for a patient post-MI? Answer: teach adherence to beta blockers and a low-sodium diet. Rationale: beta blockers reduce myocardial workload, and a low-sodium diet prevents heart failure, per AHA post-MI guidelines. 11. What is the nurse's first action for a patient with MI showing new Q waves on ECG? Answer: notify the provider and document the finding. Rationale: Q waves indicate prior infarction, requiring provider evaluation for treatment adjustments, per AHA ECG interpretation guidelines. 12. What should the nurse monitor in a patient receiving aspirin for acute MI? Answer: monitor for gastrointestinal bleeding and allergic reactions. Rationale: aspirin, an antiplatelet, risks bleeding and hypersensitivity. Monitoring ensures safety, per AHA antiplatelet guidelines. 13. What is the priority nursing action for a patient with MI complaining of shortness of breath? Answer: administer oxygen and assess lung sounds. Rationale: shortness of breath may indicate pulmonary edema. Oxygen and assessment guide therapy, per AHA heart failure guidelines. 14. What should the nurse do for a patient with MI and a CKMB level of 10%? Answer: notify the provider and continue cardiac monitoring. Rationale: elevated CKMB confirms MI. Notification and monitoring detect complications, per AHA biomarker guidelines. 15. What is the nurse's first action for a patient with MI developing atrial fibrillation? Answer: notify the provider and prepare for anticoagulation. Rationale: atrial fibrillation increases stroke risk. Anticoagulation and notification prevent thromboembolism, per AHA arrhythmia guidelines. 16. What should the nurse teach a patient about preventing reinfarction after MI? Answer: quit smoking and exercise regularly. Rationale: smoking cessation and exercise reduce cardiovascular risk, per AHA secondary prevention guidelines. 17. What is the priority nursing action for a patient with MI and a blood pressure of 80/50 mmHg? Answer: notify the provider and prepare for fluid resuscitation. Rationale: hypotension may indicate cardiogenic shock. Fluids and notification stabilize the patient, per AHA/ACC guidelines. 18. What should the nurse monitor in a patient receiving heparin for MI? Answer: monitor for bleeding and APTT levels. Rationale: heparin increases bleeding risk and requires APTT monitoring for therapeutic levels, per AHA anticoagulation guidelines. 19. What is the nurse's first action for a patient with MI showing T-wave inversion on ECG? Answer: notify the provider and continue telemetry monitoring. Rationale: T-wave inversion suggests ischemia. Notification and monitoring detect progression, per AHA ECG guidelines. 20. What should the nurse do for a patient with MI experiencing anxiety? Answer: provide emotional support and administer prescribed anxiolytics. Rationale: anxiety increases myocardial oxygen demand. Support and medication reduce stress, per AHA supportive care guidelines. 21. What is the priority nursing action for a patient with MI and a troponin level of 2.0 nanograms per milliliter? Answer: notify the provider and prepare for cardiac catheterization. Rationale: significantly elevated troponin indicates MI, often requiring catheterization to assess coronary arteries, per AHA/ACC guidelines. 22. What should the nurse teach a patient about beta-blocker therapy post-MI? Answer: report dizziness and take the medication as prescribed. Rationale: beta-blockers reduce heart rate but may cause hypotension. Adherence and reporting ensure safety, per AHA guidelines. 23. What is the nurse's first action for a patient with MI developing pulmonary edema? Answer: administer prescribed diuretics and oxygen. Rationale: pulmonary edema indicates heart failure. Diuretics and oxygen relieve fluid overload, per AHA heart failure guidelines. 24. What should the nurse monitor in a patient receiving clopidogrel for MI? Answer: monitor for bleeding and thrombocytopenia. Rationale: clopidogrel, an antiplatelet, risks bleeding and low platelets. Monitoring prevents complications, per AHA guidelines. 25. What is the priority nursing action for a patient with MI and chest pain radiating to the jaw? Answer: administer prescribed nitroglycerin and obtain a 12-lead ECG. Rationale: radiating pain suggests ongoing ischemia. Nitroglycerin and ECG guide treatment, per AHA/ACC guidelines. 26. What should the nurse do for a patient with MI and a history of gastric ulcers receiving aspirin? Answer: administer with food and monitor for epigastric pain. Rationale: aspirin irritates the stomach. Food and monitoring reduce GI bleeding risk, per AHA antiplatelet guidelines. 27. What is the nurse's first action for a patient with MI showing ventricular fibrillation on telemetry? Answer: initiate defibrillation and call a code. Rationale: ventricular fibrillation is fatal without immediate defibrillation. Code activation ensures support, per AHA ACLS guidelines. 28. What should the nurse teach a patient about statin therapy post-MI? Answer: report muscle pain and take the medication at night. Rationale: statins reduce cholesterol but may cause myopathy. Nighttime dosing optimizes efficacy, per AHA lipid guidelines. 29. What is the priority nursing action for a patient with MI and a heart rate of 120 bpm? Answer: notify the provider and administer prescribed beta blockers. Rationale: tachycardia increases myocardial demand. Beta blockers and notification stabilize the heart, per AHA guidelines. 30. What should the nurse monitor in a patient receiving thrombolytic therapy for STEMI? Answer: monitor for bleeding and neurological changes. Rationale: thrombolytics dissolve clots but risk hemorrhage, including stroke. Monitoring ensures safety, per AHA/ACC guidelines. 31. What is the nurse's first action for patient with MI complaining of arm numbness? Answer: assess the pain and notify the provider. Rationale: arm numbness may indicate ischemia or nerve compression. Assessment and notification guide diagnosis, per AHA guidelines. 32. What should the nurse do for a patient with MI and a family history of heart disease? Answer: educate on genetic risk and lifestyle modifications. Rationale: family history increases reinfarction risk. Education promotes prevention, per AHA secondary prevention guidelines. 33. What is the priority nursing action for a patient with MI and a new bundle branch block on ECG? Answer: notify the provider and prepare for pacemaker insertion. Rationale: bundle branch block may require pacing to maintain cardiac output, per AHA arrhythmia guidelines. 34. What should the nurse monitor in a patient receiving metoprolol for MI? Answer: monitor heart rate and blood pressure. Rationale: metoprolol, a beta blocker, reduces heart rate and blood pressure, risking bradycardia or hypotension, per AHA guidelines. 35. What is the nurse's first action for a patient with MI and a troponin level of 0.1 nanograms per milliliter? Answer: continue monitoring and repeat troponin levels. Rationale: a low troponin may indicate early MI. Repeat testing confirms diagnosis, per AHA biomarker guidelines. 36. What should the nurse teach a patient about exercise post-MI? Answer: start cardiac rehabilitation and avoid overexertion. Rationale: cardiac rehab improves recovery and moderation prevents strain, per AHA rehabilitation guidelines. 37. What is the priority nursing action for a patient with MI and a blood glucose of 200 milligrams per deciliter? Answer: notify the provider and administer prescribed insulin. Rationale: hyperglycemia worsens myocardial damage. Insulin and notification stabilize glucose, per AHA guidelines. 38. What should the nurse do for a patient with MI experiencing diaphoresis? Answer: keep the patient cool and monitor vital signs. Rationale: diaphoresis indicates autonomic response to ischemia. Cooling and monitoring prevent complications, per AHA supportive care guidelines. 39. What is the nurse's first action for a patient with MI developing heart failure? Answer: administer prescribed diuretics and notify the provider. Rationale: heart failure causes fluid overload. Diuretics and notification manage symptoms, per AHA heart failure guidelines. 40. What should the nurse monitor in a patient receiving ticagrelor for MI? Answer: monitor for dyspnea and bleeding. Rationale: ticagrelor, an antiplatelet, may cause shortness of breath and bleeding. Monitoring ensures safety, per AHA guidelines.